no payment on medicines.
Order. The question is that this bill be now read a second time. I give the call to the member for Wills.
Thank you, Deputy Speaker. The Liberal Party said that it would give Australia calm and methodical government. Instead, we've had a stampede, a veritable running of the bulls, replete with cries of emergency, emergency. And here the element of emergency is the cry that the system is unsustainable. Now, this is clearly nonsense, given that there is no plan to put the money raised by this measure back into the sustainability of the system. Instead, it is to be directed towards medical research. So this is completely disingenuous. And rather than seeking to discourage people from going to the pharmacist and getting appropriate medicines, the government would do better if it was genuinely concerned with sustainable health going forward into the future, to look at the issue of preventative health and improving the support that we provide for people before they get to the situation where they need to go to the doctor or need to go to the pharmacist. And I particularly want to draw, as an alternative to the government's approach, to the attention of the House, proposals that have been put forward by the Public Health Association of Australia, where they focus on obesity and they describe it as one of Australia's most important public health issues. They talk about the various medical consequences of it, and they say that in only 15 years, from 1990 to 2005, the number of overweight and obese Australian adults increased by 2.8 million, and if the trends continue, it is predicted that almost 2/3 of the population will be overweight or obese in the next decade. It also identified, the National Preventative Health Task Force identified, that a quarter of our children are overweight or obese, up from just 5% of our children in the 1960s, that almost a third of children do not meet national guidelines for physical activity, and only about a fifth meet dietary guidelines for vegetable intake. Now, what they call for is a national nutrition policy developed through an open, engaging and transparent process, and in a manner that's linked with other policies such as the National Food Plan and key policy areas such as physical activity, women's health, Indigenous health and the national curriculum. And, Deputy Speaker, having a program of prevention is far superior to the proposals here, which are that ordinary consumers should carry the cost of the government's desire to increase the cost of pharmaceuticals and, frankly, discourage people from purchasing them. Deputy Speaker, I oppose the National Health Amendment Pharmaceutical Benefits Bill. Among numerous case studies on broken promises, misleading claims and the poor priorities of this government, this bill stands out. This bill has the potential to actually make Australians less healthy. It has the potential to compound the health issues and health cost barriers that many Australians are already experiencing. And it can be summed up in the words, "Show me the money." If you're from a low socio-economic background, it's your own bad luck. If you're a single mother needing health care, this government says, "Show me the money." If you're a pensioner, the government says, "Show me the money." If you're a veteran or elderly citizen, they say, "Show me the money." If you're unemployed, a student, a concession holder, a disability support recipient, this government's response is, "Show me the money," an ideological drive to introduce a two-tiered user-pays system. And if you can't afford health care, this is a recipe for leaving you on your own, bereft. If you lose your job and you're denied New Start allowance for 6 months, this government says that's just too bad. If you're a pensioner facing cuts to your pension payments, they say that's just too bad. If you're being taken off disability support pension and at risk of going hungry or becoming homeless, they still think it's just too bad. If you're a medical student having to pay record amounts towards your HECS or help fees, then Again, that's too bad, and if you can't afford to visit your doctor because you now have to pay more for your medicine and that you've got this bill increasing the cost of prescriptions, too bad, the government says, show me the money. Now, Deputy Speaker, this bill increases the Pharmaceutical Benefits Scheme co-payment for general payments by $5 to $42.70 and up by 80 cents to $6.90 for concessional payments from January the 1st next year. It also increases the concessional PBS safety net threshold by 2 prescriptions per year and the general safety net threshold by 10% each year for 4 years from 2015 to 2018. And I need to point out to the House that these increases are in addition to the usual increases of CPI and indexation. The bill is intended to raise $1.3 billion over 4 years from the pockets of ordinary Australians. I repeat, $1.3 billion over 4 years from a government that claims to be concerned about cost of living issues. And I oppose this bill for a number of reasons. First, that the government must be held to account for its election promises, held to account for misleading the Australian people, saying one thing before the election and doing another thing afterwards. Secondly, for the negative impact that this will have on the household budgets of Australian people, particularly low-income and disadvantaged people. Third, for the negative health impact that this will have on Australians, again, particularly disadvantaged and low-income Australians. And finally, because of the opposition that's been expressed by stakeholders in the wider community to these increased health costs. Now, members opposite told their constituents before the election that the cost of visiting a doctor, the cost of buying medicine, the cost of living would not rise under them. And so much for their no surprises, no excuses pre-election claim. So much for their elevating of the pre-election promise into a sacred trust. Now, Deputy Speaker, this bill is an attack on Australia's universal healthcare system and its PBS system, and many key stakeholders have raised concern over this bill, and the House needs to be mindful of them. The Pharmacy Guild of Australia has criticised the increased cost of medicines proposed under this bill for consumers and has argued that it will particularly affect elderly people and having regard to other social security changes that have been put in place. The Guild stated that it will be tendering a submission to the Community Affairs Committee, which will focus on the practical implications of the proposed changes to the PBS co-payments and safety nets. Medicines Australia acknowledged the co-payment increases may lead to adverse health outcomes due to patients not filling in their scripts. The Consumers Health Forum has expressed great concern over the growing out-of-pocket costs that Australians pay for health care and strongly opposes the increase to co-payments and the safety net. The Consumers Health Forum has argued that an increase in co-payments will lead to a fall in people filling in their prescriptions and has quoted American research that states that when co-payments are raised to $40 to $50, people are 4 to 5 times more likely to not fill in prescriptions compared to when there's not a co-payment. And the Public Health Association of Australia, the CEO Michael Moore, has stated that the measures are inequitable and will affect society's most vulnerable members. He's argued that the people to whom this is most important are the vulnerable, such as Aboriginal and Torres Strait Islanders, people from low socio-economic backgrounds or from non-English speaking backgrounds, and the elderly. The Australian Doctor reported earlier this month that while debate has raged over the government plans to get children and concession card holders to pay $7 to see their GP, that there's been less discussion on the effects of increasing co-payments for PBS medicines. And indeed, I've had constituents say to me that the impact in terms of the PBS co-payments is more serious than the impact of co-payments to visit the GP. The Parliamentary Joint Committee on Human Rights, in its evaluation of this bill, noted the effect of the bill will be to increase the cost of medications for all consumers, including those reliant on social security payments, and that the proposed measures represent a limitation on the right to health and/or regressive measures which is not explicitly addressed in the Statement of Compatibility for the bill. Deputy Speaker, back in June, on the 23rd of June, I tabled a petition in this House from the Australian Pensioners' Voice, who were calling on the government to increase support for pensioners, particularly in relation to health care. Now, this is a bill which ignores the calls of Australian Pensioners' Voice, its members and the 25,000 pensioners and elderly residents who live in my electorate of Wills for more affordable and accessible health care. And people who are in my electorate, whether it's Brunswick or Coburg or Pascoe Vale, Fawkner, Glenroy, Strathmore, whether they're elderly or of working age, they should not have to pay more if they are sick, if they need health care services, if they need medicines. We should be debating positive health policy in this chamber rather than getting the policies that are coming forward in this bill and others that are looking to get those who are doing it toughest in this community picking up the tab. I want to turn to some of the comments that have been made by the Prime Minister and this government from its days of opposition, and just see how these comments equate to what's going on in the legislation before the House. We had the now Prime Minister saying back in September 2007, "What are the 4 big challenges facing the Australian health system? First of all, there is the challenge of affordability. Affordability is a serious issue." And then, of course, the government does not want people to worry about whether they can afford to visit the doctor. No one likes to see people paying high costs, particularly for their health care. No one likes that. More recently, in February this year, the Prime Minister was asked at a doorstop, "Prime Minister, would you consider means testing a co-payment to help relieve the pressure on the health budget?" Prime Minister, obviously the budget generally is under pressure, and it's very important that we do what we can to fix the budget as quickly as we can, but have got to do it in ways which are consistent with our pre-election commitments. Don't forget, I said we were going to be a no surprises, no excuses government, and you might also remember that I was the Health Minister in a former government, and as the Health Minister in a former government, I used to say that the government was the best friend that Medicare had ever had. This leopard doesn't change his spots. I want this government to be likewise the best friend that Medicare has ever had. Well, Deputy Speaker, at no stage was there the slightest suggestion that when in government, this government would increase the PBS co-payment for general patients to $42.70 and for concessional payments to $6.90, and this bill gives the lie to the promises and mistruths that were peddled before the 2014 Show Me the Money budget. Now, we do have some Liberals willing to admit that this approach to health funding is wrong and that it will hurt patients and frontline services. And I want to draw the attention of the House to some of the comments of the government's state colleagues. We had Campbell Newman on the 14th of May saying a big red cross is cutting health and education spending. It's not acceptable. We had Tim Nichols, the Queensland Treasurer, saying we think that they are an attack on the state's delivery of health and education services, and you can rest assured that we'll be taking up the challenge in Canberra to revisit some of these decisions. You had the Health Minister from Queensland, Lawrence Springborg, saying the real impact for us comes in 2017-18. The real issue for us is the long-term aspects that come from and impacts that come from uncertainty with health funding. And finally, he said on the GP tax, we fundamentally believe in a taxpayer-funded free public hospital health system, and this actually in some ways goes counter to that. Well, it certainly does, Deputy Speaker, and I appeal to members opposite to listen to your Liberal state colleagues. Stop attacking the universal healthcare system and protect it. How much you earn should not determine whether you have the ability to access healthcare and medicines. Deputy Speaker, I oppose this bill on the basis of its costs to Australian families. Just today, I visited the Australian Nursing and Midwifery Federation on the lawns at the front of Parliament House to support their campaign against the Liberal budget cuts. Whether you're a health sector worker or a health student or a patient, you are entitled to better treatment than you've received from this government in the form of the budget and in the form of this legislation, and I urge the House to reject this bill.
Order. The question is that this bill be now read a second time. I call the member for Macon.
Thank you, Mr Deputy Speaker. Mr Deputy Speaker, can I begin by commending the member for Wills for his contribution to this address, because I believe he's summed up many of the issues very, very well. Mr Deputy Speaker, this is a bill that effectively raises $1.3 billion for the government by increasing the costs of pharmaceuticals to the people of Australia. In fact, the cost of pharmaceuticals for mainstream Australia goes